Welcome to Williams Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I'll be discussing recent changes to the rules governing health flexible spending arrangements and cafeteria plan mid-year elections. Since the Affordable Care Act was enacted in 2010, we've had a restriction on the types of medical expenses that can be reimbursed from a health flexible spending arrangement. Specifically, as of January 1, 2011, health FSAs could not reimburse the costs of over-the-counter medication unless the participant had a prescription for the medication. The CARES Act, enacted in response to the COVID-19 crisis, changes this. And so effective as of January 1, 2020, a health flexible spending arrangement may reimburse the costs of over-the-counter medication, regardless of whether the participant has a prescription, and can also reimburse the costs of menstrual care products. This may require a plan amendment. So if the plan sponsor wants to adopt this change is voluntary, a plan may need to be amended. And that depends on whether the plan specifies specifically the types of expenses that can be reimbursed from the FSA, or whether the plan document cross-references the Internal Revenue Code. Because the Internal Revenue Code has been amended, if the plan simply cross-references the code, a plan amendment would not be required. And again, this is a voluntary change, so plan sponsors can decide whether to expand the types of expenses that can be reimbursed from a health FSA. Additionally, the IRS has provided more flexibility for cafeteria plans. Generally, a cafeteria plan election made by a participant before the beginning of a plan year, when a participant elects what health and welfare benefits the participant wants to purchase with pre-tax dollars, those elections are locked in for the entire plan year. The Section 125 and the regulations generally frown upon mid-year election changes for cafeteria plans unless the change is due to a change in family status or one of the other qualifying events under the regulations. In response to the COVID-19 crisis, the IRS issued Notice 2020-29, and 2020-29 provides new mid-year election change opportunities for cafeteria plans. And just like the expansion of FSAs, this change is voluntary. And so plan sponsors can decide the extent to which the plan should be revised to allow these new mid-year election changes. So these changes, here they are. So with respect to group health plan coverage, a participant may make a new election on a prospective basis if the employee had initially declined coverage. So if you have an employee who did not enroll in health insurance and now realizes they really need health insurance, this new guidance would allow the employee to enroll in coverage mid-year, even if there was no other qualifying event. It doesn't require a loss of other coverage or gaining a dependent or any of those events that we're used to allowing a mid-year election change. This is a flat out, the employee simply wants the coverage. They can make the mid-year election change to add health coverage. Additionally, if an employee wants to change the plan that they enrolled in, so let's say someone enrolled in a high deductible plan and they want to switch to a plan that has a lower deductible, or they want to otherwise change the plan option that they elected at the beginning of the plan year, this new guidance would allow the participants to make that change without any other qualifying event. Also, if someone wants to unenroll from the plan, to revoke their election of health coverage, they can do that as well. But this one has a little bit of a catch to it. The employee has to get a written statement that the employee is enrolled or immediately will seek enrollment in other health coverage that's not sponsored by the employer. So in order to allow someone to drop coverage, the employer has to get a written statement from the employee that they're going to get other coverage. Additionally, with respect to flexible spending arrangements, an employee can revoke an election, make a new election, or decrease or increase an existing election with respect to their health flexible spending arrangements. And the same rule also applies to dependent care assistance programs, as long as those elections are made on a prospective basis. Notice 2029 provides a model written statement for employees who want to drop coverage, and so that's in the notice and should be used by employers who adopt this change. And also, these mid-year election changes are completely voluntary, and an employer has discretion to limit them to the extent that makes sense for the employer. So let's say an employer is concerned that employees who are in a low coverage, high deductible plan are all going to switch coverage to a more generous plan option under their plan. The employer could draft the plan amendment to restrict the ability to do that, to not allow people to go from one plan to a richer plan. So the employers have discretion either to adopt these, to adopt some of them, or to even restrict the election opportunities. In addition to notice to the changes to mid-year election changes, there also have been expansions of grace periods and carryovers. And so some flexible spending arrangements allow a grace period, a 2.5-month grace period after the end of the plan year, during which an employee can use leftover money from the prior plan year to cover expenses occurring during that 2.5-month grace period. Notice 2029 provides an extension of the grace periods until the end of this year. So even if a grace period would normally have expired in March or would expire in June, the grace period now runs through the end of 2020. Additionally, if the plan has a $500 carryover for unused amounts, the IRS Notice 2020-33 increases the carryover from $500 to $550. All of these cafeteria plan changes, the mid-year election change, the grace period extension, and the $500 to $550 FSA carryover must be reflected in a plan amendment, but plan sponsors have until the end of 2021 to adopt the amendment. So it's important, if these changes are made, to document exactly what the decision is, so that you know how you're going to administer the plan in accordance with these changes, but then to get the amendment adopted and executed by the end of 2021. So that'll wrap up our discussion of the new cafeteria plan and health FSA guidance. If you have any questions or suggestions for future episodes of this podcast, please contact me. You can also visit our employee benefits page at williamsmullen.com/employee benefits. There you can find out more about our team as well as past episodes of this podcast and legal alerts. Be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.